There has been more records come into this agency since the time we've had the Case Aide Services than I would say probably in the last 5 years or so. When you have 10 caseworkers and all of them are contacting the facilities for medical records, this has streamlined that process. And now it is easier for the caseworkers to just make the request that they need the records and make arrangements to get the releases. And, we get the records back in just a few days. The Case Aide Services also will make referrals for us. We just have to provide them with the information, and they will take care of filling out the form and getting it to the appropriate facility for services. And if there's not been any contact made with the family, the case aide can then go back and make contact and say, what happened with this? Is there something else that's needed? Just that follow-up at times that caseworkers are not able to provide given the time constraints that they have and the number of cases that they have. The case aide has also assisted me in preparing staff for court, which does cause stress for me, especially when I have several people that I'm supervising and don't always have the amount of individual time that I would like to have to spend with each individual staff member. I know the case aide has familiarized themselves with the case before, met with my staff members, asked them questions, talked about court testimony with them. Our case aide has met with our attorney and knows what the expectations are when they go to court, and the attorney has provided questions that the case aide would then go over with the staff member just so they can prepare answers. The Case Aide Services have also provided input at different times when they're reviewing cases with us about different things that they can do that maybe nobody is thinking about. Whenever we have a review of a case, the case aide will volunteer to take on some tasks that they are able to do as far as reviewing the case, putting together discovery for court purposes, or even asking questions and going over the case with the staff. Occasionally, I have put in tickets for my staff when they're on a case, like for example, doing a removal. I may send a ticket needing school information, medical information, social security cards, birth certificates, mental health records, psychologicals, treatment records for the child that we have in custody so that we can get that information where it needs to go. Also, the case aide has participated and been available to using the records that we have, create summaries for children and send those out in the hopes of looking for placements for children that we are having a difficult time placing. All of these services have helped our agency and helped me specifically get my job done because someone else is taking care of this. Someone else is obtaining the school records and the IEP and the ETR so that I don't have to try to obtain these records if my caseworkers are out in the field, protecting children and making sure that they're safe. And, someone back here trying to get these other documents that are going to be needed for the placement or for the enrollment in school.